When consulting at veterinary clinics, I suggested feeding the animals treats in order to reduce fear through counterconditioning. But the veterinarians I consulted with were hesitant because of the fear that it might increase the risk of aspiration pneumonia, or AP, in case the animals were sedated. I wanted to know more about the data supporting that assumption, so I conducted a literature search. AP is a very serious disease and is often a side effect of sedation or anesthesia. Up to half the number of dogs vomit or have gastroesophageal reflux, or GER, during such procedures. And this GER sometimes also leads to AP. As we see, GER is not unlikely to occur as it is, but will treat feeding animals in the clinic increase the number of GERs or the risk that they end up as APs? Known predictors associated with the occurrence of post-anesthetic AP in dogs. A staggering 69% of dogs with 2 or more of these predictive variables developed AP. Now, the only factor among these that could hypothetically be affected by feeding treats before anesthesia is regurgitation. Will fasting reduce this risk? Actually, extended pre-operative fasting, including no access to water, leads to a higher incidence of GER. However, there are higher risks associated with larger volumes of aspired fluid once GER has occurred. So for this reason, we want to avoid large gastric volumes after all. To what extent does the added contact affect volume? Homogenized or liquid content passes very quickly through the gut, so there might actually be a net negative gastric volume even after adding small amounts of treats in the vet clinic, especially if what you feed is semi-liquid. In contrast, stress inhibits gut motility, so it's likely that in a stressed animal, stomach volume may remain unaltered during the veterinary consultation. This scenario would be more likely if you're not treat feeding. So it could potentially be riskier not to feed treats than to feed appropriately. Hypoallergenic and low-fat options should be available for medical reasons. Gut motility is higher in low-calorie or homogenized food, which helps reduce gastric volume. And finally, multiple options should be accessible so that even picky animals are likely to find something palatable. One factor that we could potentially influence with regards to this discussion is whether the animal vomits or regurgitates during sedation or anesthesia. Treat feeding should not affect the risk of vomiting, but the choice of sedatives most certainly will. Table 2 lists drug class, the actual drugs, and whether vomiting or nausea were listed as potential side effects in at least one of the 3 sources that I used. Some of them, like azaprosamine, actually reduce vomiting associated with opioid administration, which is seen in dogs. These are some hypothetical effects of using treats in the process of counterconditioning. With regards to the animal, we may expect stress to be reduced and that the number of AP cases should be unaffected or even decreased. It should be easier to examine and diagnose the animal, and the risks associated with handling an aggressive animal should be diminished. The owner might be able to stop worrying about the animal hurting someone and also learn some powerful techniques that could be used in other circumstances where the animal is fearful. Not using treats is a decision with potentially adverse effects. Animals may gradually become more agitated. Stress inhibits gut motility, and maybe more animals need to be sedated in order to be examined, which could potentially contribute to a higher number of AP cases. The accuracy of diagnosis may be compromised. Fearful animals may show defensive aggression, so there's a risk of injury. And the owner may hesitate to take a fearful animal back to the vet. I encourage treat feeding in the vet practice since the benefits outweigh the potential risks. Choosing not to feed treats is an active choice with multiple negative implications, including a potentially increased number of AP cases. Thanks for listening. I hope you enjoy the paper.